So you have this SMART process, safe mercury amalgam removal technique, SMART process that happens, that protects you, takes, makes sure the vapors as they're getting out aren't going into the patient themselves. So they're not becoming overwhelmed by mercury, as you start to remove these. What is the additional process? Let's start with what are you using then to place into the teeth rather than when you take out the mercury fillings?
Well, first of all, patients are going to be covered if they were going to get a kidney surgery with me. I joke around because my surgeon that works with me said, "Oh my God, Yani, your full coverage is more sterile than mine." No, I'm joking. But the material that we use to replace has to be a material that is inert. It has to be biocompatible. I usually like to do a biocompatibility test on my patient to customize the materials that will cause less reactivity to their immune system. For the most part, I've been using some German products that are called Ormoser. So are silica particles in an organic matrix that doesn't have bisphenol A and doesn't have fluoride. And that's my material of choice because I see that for most of the biocompatibility tests, my patients are not reactive to it. Surprisingly, I had also another interesting case. This young female in their early 20s got some fillings done in Mexico. They put a material and she started having a lot of neurological condition, headaches, ringing of the ear, tinnitus. Saw 6 dentists. They told me, "Oh, you're crazy. You need to see a neurologist or a psychiatrist." I started recommending her a biocompatibility test. Do your homework. Try to find out what material was put in your mouth. She was the most reactive to the resin bonded filling that I put in. I mean, we're perfectly done. I even feel bad removing it, but knowing that those materials were creating a reactivity in the body, it was our duty to remove. But by the time I was removing half of the mouth, the patient already was improving. I said, "Oh my God, all these psychotic events and ringing of the ears, they're disappearing." A year later, she got married. So can you believe that? If that can happen, that's a miracle. So I just want people to be a little more cautious on when they select dentists. Not always the cheapest is the best. And especially somebody who's not evaluating on an individual basis what's the ideal material for the patient. Make sure that they don't leach out or create galvanic corrosion, because galvanic corrosion happens and we see so many different alloys being incorporated in people's mouth, from titanium, from gold, palladium, platinum. Then if they get a removal partial denture, they get chromium, cobaltum. It's just a human battery. Our brain goes crazy,
Yeah, and this is a story I've heard in many, many patients that they may go to some, doctor that tells them, "Oh, you have higher mercury levels. Did you have amalgams?" They do that research, but then they just, they say you need to get them removed. Next thing you know, they go to a doctor that doesn't remove them properly, and suddenly the patient exacerbates the symptoms. It gets worse. They remove them all at once without safety protocols, just pulling out, yanking them out, and that patient gets really, really sick.